KSMO Radio. It's our final Wednesday of the month. That means Dr. Kyle Ouzts from the Dent County Vet Clinic is here. And Dr. Kyle, good to have you in today. It looks like you've been hard at it today. You've been busy. Huh? It's that time of year. You get to this kind of weather, you got to take advantage of it, right?
It's good weather. Yeah, make hay when the sun shines, right?
There you go. I'm sure making any kind of hay this summer. Boy, it has been crazy with first off the drought and now the rain's coming in, and a lot of different things are happening. Got Labor Day weekend. Weather's actually pretty nice for this time of year in August. But we are here to talk about your pets. And if you have any questions about your pets, your cats, your dogs, give Dr. Kyle a call here, and we can talk about it. He can address that situation right here on the line, 729-6659, and we can try and help you out a little bit. One of the things that obviously we do want to talk about this time of year is the change of the year. We're going from summer into fall season. There's a lot of things that happen this time of year. Some other animals, like reptiles, do go into hibernation, and they get a little bit testy. Don't they, like snakes and things like that? That does happen, doesn't it?
Yep, they certainly do, and especially when it comes time if they're getting ready to molt, and their eye caps kind of cover that, and their vision gets bad, and they get more testy then because they just can't see as well, and so they just get a little bit less tolerant of things. So they certainly can.
But it never stops the I guess the curiosity of animals. They always like to go sniff. They want to look. They want to see, and usually, and most animals have a pretty good sense of when danger's around. They'll back off if they think, but sometimes you just get caught too close.
Absolutely, yep. We do occasionally see snake bite on things, and especially when whether it gets colder, the snakes are slower to move, and they're a little bit slower to get out of the way, and they end up having closer contact. But they can bite. We have better ways to treat them now, especially with Class 4 laser. It really helps the treatment process.
If a pet is bit by a snake, does the owner of that pet, should they try and get the snake, or should they just try and identify it through the color of the snake, etc.?
It does help a little bit to know what it is. There are certainly some antivenoms you can get hold of sometimes. For the most part, we have pit vipers here, which are treated pretty similarly, and about 30 to 40% of bites are dry. So even with the pit viper, if you have no swelling and no pain, there's no venom in there.
Yeah, we had a few copperheads around, and but some animals still like to get in that water, and there are some water moccasins out there, and they can be very dangerous to your animal.
Sure can. Yep, and they're not one to back away. They're fairly belligerent personalities. Those guys.
Yeah, they like to attack sometimes. They just don't like to be disruptive whatsoever. So, kind of keep that in mind if your animal does venture off and it does possibly encounter a bite. You want to get that addressed as quickly as possible too.
Sooner is better. Typically, in problems like with pain and swelling is the first couple of things you see, and that's not hard to tell. You can tell it. They'll usually whine quite a bit and cry out just because it is quite painful, and we can get that stopped fairly quickly with some pain relievers and those kind of things. And then we also I just put them on antibiotics because you do get sometimes some secondary infections because that there are some bacteria on those fangs, those things that can leave some infections and get them going. So.
Ticks and fleas still an issue right now. I mean, we've had some hot days, and of course, it was brutal for a while. Then you get the moisture in there, and of course, once that rain starts coming in, like we had the other day, Dr. Ouzts, you have a lot of buildup of water. There's still a lot of mosquitoes out there, things of that nature. People still need to watch their pets very closely.
Yes, and we do typically actually see the tick problem starts to fade a little now in a way. There'll be another burst probably in about 2 or 3 weeks, and then it'll kind of fade on down as they go dormant. The flea problems tend to peak right now because they've been building all summer, and now some areas have these huge populations of fleas, and they tend to peak out and get really bad. Usually August, September. So those problems that we're dealing with quite a few right now with people right now, and there's some misconceptions that make those problems harder to deal with, and so some of those things help clear some of these up. Like one of the tricks on those things is if you have a product that will kill them and it kills them consistently, you're going to need to go that at least 5 months to get the last egg to hatch out and get it killed, and then you'll have them gone a lot of times. But if there is another animal coming around that has fleas, people often think that the fleas just all bail off the animal and they'll jump on the next animal, and they don't do that very much. But they do drop eggs wherever they shake, wherever they move, or they jump. Those eggs fall off and hatch there. But the fleas that are on that dog pretty much stay there. But the eggs fall off anywhere that animal goes. And so once those eggs get dropping, you're going to have a 4 to 5 month commitment trying to get rid of them if you want to get them gone. You can do it, but anytime you treat no matter how good your product is, if you treat for a time period shorter than the last egg hatching is, they're going to appear to just come back. And they do come back. Not that they move back in. There were some just still there that just finally hatched out. So it takes a while.
And not only that, but if they should lay the eggs in the house, that's going to be under a controlled condition, and those fleas can hatch off in the house. And the next thing you know, you think you have your flea problem under control, and you really don't have anything under control.
To help clear up for people a little bit about that, to be technically correct about it, the flea lays an egg every 40 minutes on the dog. So if you want to know where the eggs are, where is the dog?
Yeah.
And so,
Right.
because all those eggs are slippery, they just fall off. So it takes the body vibrating in to make that thing fall out, and it falls out. So it's springtime indoors all year. It's summer outside, winter, spring, fall, but indoor it's spring all year long, and that's perfectly fine for as long as there is some organic matter for that little larvae to eat. When it hatches into a little larvae and crawls around and eats things, it'll survive into pupa stage and then hatch out into an adult. So the fleas, they don't care where they are.
No.
They do not do well on extremely hot, dry things like sidewalks, or if you have mowed grass that gets 10 hours of sunshine a day, they don't do well there. If you have something that's frozen, they don't do real well there. But if you have shady, muddy areas, do really well. If you have, shady areas with organic matter, like the cracks in hardwood floors, do fine. The things gather in there, and they can eat there and do fine. So they don't mind living indoors. They're fine. Just a matter of how their food source. If food source becomes toxic to them, and if they get on a treated animal, and then that flea will die. But if untreated, they'll just keep on rolling.
They do keep on going. Matter of fact, I was in property management in St. Louis, and we had an apartment where they were not allowed to keep pets. This young lady had a dog, and it had fleas. Well, she moved out, didn't tell anybody she moved out. And as our maintenance guy walked in the door, he took one step in, and his legs were absolutely covered. And then you saw this explosion of fleas in the middle of the room. Well, immediately got out of there, but still, he had a number of flea bites on him.
And that helps. What I was talking about a minute ago, that kind of makes sense of it, was we have reports sometimes. Real estate agents will say that people are in there, but once they left, all these fleas moved in there.
No, they didn't move in.
No, all they were was eggs that were sitting there from the last pet. But they hatch out over 1.5 to 5 months.
Right.
And so when they walk in a month later, they think, "Wow, how did all these fleas get here?" They were there. They were eggs the whole time. They finally reached adulthood, ready to hatch out. And now once they get ready to hatch, they don't just randomly hatch. They wait for something that makes them think there's food supply nearby. So one of 4 things will make them hatch out: vibration, carbon dioxide levels raise up in the air like breath,
Right.
Changing light, which means like something's walking by, and changing light things, or warmth. Those 4 things, and they wait for those 4 things. And a lot of times you have all these eggs ready, and they're all waiting for the same thing. And you walk in the door and bang the floor, and it vibrates, and they all know it's time. And then so they hatch.
So, and you're the meal,
That's it.
and you really don't want that. So
That's
again, watch your animals, because they can bring fleas in, and even though you have something that you think, there's no fleas on my cover of my sofa or whatever it might be, don't be convinced of that. Especially if you found fleas on your pets, definitely want to take the right precautions to get that taken care of.
And I tell people too, we don't class ticks and fleas the same. They're different critters completely.
Sure.
And you can have a couple of ticks and then not really have much of a problem. Not fleas. Fleas, you either have them or you don't have them.
Right.
There's no in between, because if you have them, they're laying eggs every day, and those eggs are going to hatch later, and you're going to have an exploding population later on. So ticks aren't like that. Ticks go off somewhere and they lay a little nest after they feed somewhere. But they're different than fleas. Fleas just lay every 40 minutes. They just drop off wherever they hang out. So
They
different deal.
multiply fast.
Yeah, different.
And so anyway, but definitely want to make sure you watch out that for your animals, and do the right precautions. Flea and tick protectant, it's really good for them, but that doesn't mean you don't check your animals. Right. You still need to check them.
And I tell people too, we get people call sometimes and say, "Hey, my animal's itching, I need a flea product." But I tell them, I have some animals that come in that have allergies that don't have a single flea on them, but they're wanting to buy flea products. And I think, let's get a look at it and make sure you actually have that, because if you don't have fleas, you don't need to buy an expensive flea product, and that's not the problem. So let's get a look at it and make sure that's what you have, but you can treat them. And I can tell you how to do it. It's just a matter of following certain directions, and you can get it.
And I'm glad you brought that up, because a lot of people think that animals don't have allergies, but they do, just like people do, don't they?
Regularly, yeah. We see, in fact, skin problems, which are sometimes allergy-related or allergy-based completely, is the number one reason animals come into vet clinics nationwide. 40% of animals come in for some kind of skin problem, and not everyone, but many are allergy-related or allergy-created completely.
And a lot of those can be just dry skin, acts like psoriasis on a human being. You can actually see the patches if you look close enough, and there is treatment for those to get your animal back in tip-top shape so they're not scratching all the time.
Right, yep, that's very, very common, and we do see a little bit, humans, typically we see a lot of respiratory allergies. You see a lot of sneezing and coughing things, and you see all the things. Dogs, not so much of that. We see much more skin-related allergy, whether it's itchy ears, itchy front feet, itchy belly. There's a lot of things that we see that are allergy-related, but a little different than people. People say is more respiratory stuff.
Well, as we're moving into a new season, what can you recommend for older dogs? Because, in the summertime, a lot of people bring their animals in, which is good to get them out of the heat. But then as it gets to this time of year, they might leave them outside a little bit longer. But as the older animals, do they adjust to the temperatures as well as the younger animals do?
That's actually a point I was going to make, and you brought it right into it. Anytime I talk about extreme weather, hot or cold, I use kind of a risk assessment idea and think, this animal here, what is his risk level or her risk level? And it has to do with several things. It has to do with hair coat type. When you take a greyhound versus a chow, it's very different. It has to do also with metabolic activity, with metabolic rate. For example, I can take two dogs, one's a year old and one's 10 years old. Their metabolic rate's different, and like kids, they don't get cold very much, and older folks get cold easy, and so that makes a difference also. Level of activity, which is not metabolic rate, but level of activity. The hyper dogs don't get as cold because they're all over the place, and the couch potatoes, they get cold easier because they just lay around. So it makes a difference also. Exposure length, how long they're out, makes a difference also, and that obviously we can control that very well. But the thing I kind of think about people is I try to have them realize that the risk level their dog has this year will change next year, because I've had people come in with dogs that were badly cold exposed and were super hypothermic, and they think, well, I can't believe he's been out great in that same place for the last 13 years. I'm not sure what happened this year.
13 years.
Yeah, he's 13 years old, and so he's not a 2-year-old dog anymore. He's not a 5-year-old dog anymore, where he's a big, robust, healthy dog that handled the cold, and so that they do change. The assessment does change.
Absolutely. And a lot of things too can change too. That wherever they may have been before, maybe there's a set of bushes there that are no longer there. Now they're getting a wind chill that they never had before, and you're assuming, hey, nothing has changed with my dog. Well, maybe your dog hasn't changed, but now it's getting an additional blast of cold air every 8 to 10 minutes. That's going to change. Like, it wouldn't be good for you either.
Right. And outdoor animals, the things that I really look for to try to assess the risk on them is moisture. You get rain on a dog in the winter, and it's hard on them. It's really tough. Again, wind, and wind chill, and wind, that makes a difference. And also, are they getting solar exposure? Are they getting, because it can be pretty cold with the hard sunshine. If the dog lays in the sun, they can do a little bit better. So if they're in the shade all the time, where they get rain splash and where they get wind, that's really hard on them. Really tough. So.
Yeah, any time, and especially, and I remember years ago we had an animal. The vet said make sure they're not out in an ice storm, because that ice will get on their fur and they will get chilled even quicker, because there's no protection now, and that ice is right against their skin. I assume that's true, correct?
It can be, yeah, and hair coat type makes a big difference too. And we just came from Alaska, so we dealt with those things a little bit. Up there, they do have mostly big dogs that are outdoor, and some of them do quite well. Some of them actually like it when it's really, really cold. But it doesn't matter. Hair coat type makes a big difference, and then how long are they out in their environment they live in. But they can, if they get real wet, you can have troubles. And if it's just snow that stays on the top of their hair coat and doesn't melt, they can do okay.
Dr. Kyle Ouzts from the Dent County Vet Clinic. Let's talk a little bit about the importance of your animal's teeth too, because yes, dogs do get tooth decay. Yes, they do lose their teeth, and as they grow older, you may see a tooth here missing or so. But is there a better way? Obviously, I've heard some big expensive people, they have these groomed dogs, and they go and they brush their teeth all the time. Yes, you can do that, but animals have their own way of kind of keeping their teeth clean, don't they?
We've learned a lot about that over the last decade, especially. And the single biggest factor in how much tartar plaque tooth decay you get is genetics. Just anybody who deals with a lot of animals looking at their mouth knows that Yorkies are the breed that if they're not in trouble by age of 2, that's unusual. Usually their mouth is rotting out by the time they're 2 years old, 3 years old. So certain breeds, I have some hounds come in, and it's unusual to see a hound with bad teeth. Their teeth just, their mouth battles it off really well, and they do a good job. So there's a big difference in genetics. You mentioned, brushing. It is the gold standard. It's not always possible. Some dogs won't tolerate it, but if they will, it's the gold standard for teeth. And it keeps them cleaner than anything else. Because with us people, we deal with plaque, and we brush our plaque off every day, and so we never get to the tartar stage very much, unless something weird's happening. But animals, usually their plaque stays on, and then tartar begins to build up sometimes. Chewing, we used to think was a great help, and it does help some, not like we used to think it did. And so if they chew on a bone or chew on something, that helps a little bit, but not like we used to think.
But there's a lot of products out there that they lead you to believe if they chew on this product, it's actually cleaning their teeth, and it's making their breath smell good and everything else. Probably a bunch of hogwash there, right?
It has just enough truth to it to make it true, but not to the point they're saying. Because I see animals that come in with chew toys, those kind of things, sometimes need bad dentals, because again, genetics is a major part of it. But something do help a little bit. There's even a special diet called TD or Tartar Diet, and it helps some. And nothing is perfect, but it helps some. And so, there are some things that help some. There's some chews that are impregnated with some antimicrobial, antibacterial stuff to kill bacteria, and that helps some. Those kind of things. So there's a few things that help some, but some animals they just have to have dental sometimes, get them cleaned up, and we've got a dental unit set up there at the clinic. And actually, our next project in the remodel is we'll build a dedicated dental suite, so it'll have just for dental work only. But we're doing them now in our prep area. But we'll take the plaque off, take the tartar off, polish the teeth, get the bad ones, remove them. Usually treat with some fluids and some antibiotics and things too to try to get them feel better. And many times these bad mouth dogs, very commonly, you'll hear people call in a week later and say, he seems like he's really feeling really good now. But sometimes it takes a week to get all those rotten teeth problems out of the way, and all the swelling out of the way, and all the infection out of the way. And then a week later they start feeling pretty good.
We're talking to Dr. Ouzts from the Dent County Vet Clinic. If you have a question, feel free to call 729-6659. But teeth, just like in humans, if you don't take care of your teeth, it can cause it to be a fatal condition, can't it?
In certain conditions, what we see more commonly is dogs that just start laying around a lot. They lose a little bit of weight sometimes. They just are more sedentary because their mouth and their face and their head hurts, but they can't say it. And so they just become, kind of quiet. And then, sometimes after these big dentals, we'll send him home, and then a week later, and he's running around playing again. He's playing with toys and stuff. And I think just the achiness, they can't tell us what's happening, but they just get quiet and just kind of get
lethargic. Anyways, you would too if you've got a pain in your mouth, you don't want to do much, and think about a root canal. Who wants to go get one? Nobody wants that stuff of any way, shape, or form. One of the things that we start to see, and that I see a lot of people wanting to do at this time of year, is they like to go buy clothes for their animal, especially you see it in the city a lot, sweaters, even some little paw mittens, things of that nature. Does that actually help the animal in the wintertime?
There are certain situations that, again, go back to things like very short-haired dogs. If they're out quite a bit, those little jackets can help a little bit because it just slows core body temperature loss. So it can help a little bit. I don't see too many problems created by them. Most of them are designed now to be pretty good, and those dogs are usually monitored real closely, so they're not out there for 12 hours wearing this stuff with nobody knows about it. So they don't see a lot of problems with them, but there's times that it's helpful. There's other times that, I have some little things like Pomeranians come in with a little jacket on. The Pomeranian's got a hair coat so thick they're panting already, and so then they get a jacket on. But, and a lot of those little dogs that are long-haired dogs, they pant all the time because they're hot, and so their indoor temperature to us is nice, and to them it's a little bit warm. But sometimes those things, they don't are necessary, but they do help some little short-haired dogs, Chihuahuas, and those kind of things that are short-haired. It does help them stay warm a little bit.
How about a lot of the dogs that do shedding, and especially when the temperature changes, and it seems like their hair is super thick, and then it gets a little bit thinner. But as the temperatures change sporadically, like we had the super hot 2 or almost 3 weeks, it was just extremely hot, and it seemed like dogs were shedding an immense amount of hair. It may just seem like that because they're probably inside a little bit more than they would be outside, but is that true, or is that still kind of a wives' tale?
There's a number of things that can affect shedding. Certainly breed makes a difference. Breeds that have continuously growing hair, like poodles, shed less because the hair follicle goes through 4 stages in its normal metabolic work, and one is a preparation stage, a hair growth stage, what they call an incision stage, where it drops the hair out, then a reset stage, and then it starts again. However, if one, like poodles, that their hair follicles stay in the growth stage, they just keep growing, so they never reach the stage where they just had to kick it out now.
Right.
Things like shepherds and pugs, they grow a hair, shed it. Grow a hair set, right? And they just grow, all the time.
Yeah, they're in your hand almost when you pick them up, right?
Yeah. You'll see more variation in shedding in outdoor dogs as they're more exposed to day length changes, which affect the pineal gland and secondarily hair coat things. But they also temperature changes too. They're affected a little bit more by this. Indoor dogs that just got to potty, they do a little less seasonal shedding than what the ones that are outdoor dogs do. But usually outdoor dogs, they'll thicken up in the fall and they'll shed out some in the spring. Diet can make a difference too. Diets absolutely change the hair coat, and we're learning more and more, even in humans, that if the gut health is good, then things like skin and hair coat do better. So there's differences with that in both dogs and people.
And it is important to get your pet on a good diet. Yeah, I think people make fun of cat food, dog food. You hear about them, we see them on TV, and they always go to brand X, and they always have the other brand. It's always fantastic. There are some very, very good nutritional meals out there for your pet. And if you have a pet that's suffering possibly from its diet, you're going to notice it. They're not going to be very active. They're not going to have that drive to them that most pets do. And I know you guys can put together a good diet for somebody, for that animal that they have, can't you?
Yeah, we've gone through. I've had quite a bit of experience with like I am Eukanuba, with Science Diet, with Purina, and all of them can do a really good job on things. One thing I always mention about Purina, it's a good company, but they have a different philosophy on foods than a lot of companies do. Purina makes everything from extremely high quality. Their Pro Plan line is one of the best ones made, but they also make pretty good food, sort of good food, not too good food. And they make junk. So their idea is, let's cover every shelf and every price point, and hopefully they'll buy a Purina diet. Where other, like Science Diet, doesn't do that. They make kind of premium diets is all they make.
Sure.
And then some of them, like you'll see, alley cat food, they just make the lower end stuff. And so, but Purina makes all levels, and some things that are a little helpful just as far as overall guidelines. Typically, the best foods don't have food coloring in them. There's not really much need for blue and red and green foods. That's just to hook the buyer.
Yeah.
They also don't typically have the really, really cute shapes, because cute shapes aren't part of nutrition. That's to hook the buyer. That's all it is. Just
never saw a dog worry about a shape when it was hungry.
Nope, not at all. And so, some of those things are just marketing things. They're not about nutrition. But there are some good food studies that have been out, and there's a few brands that tend to come up in the top as far as nutritional quality in studies where the analysis is done blind, so people don't know which brand they're testing. They just test it and they come out with the result. But Pro Plan's been very good. Science Diet, Royal Canin's been very good. I am Eukanuba. That's been kind of our top ones that are out there. So there's good brands out there.
So when people see the ads on TV, they're catering to the human side of the pet, not to the pet side of the pet, because, hey, if it looks good to me, it must be good for my dog, right?
Right. There are essentially kind of four basic philosophies companies use to market. They use premium nutrition. That's one.
Right.
They use premium attraction, and that's for the buyer, not for the dog.
Right.
They'll use premium flavoring, which is for the dog, but it's usually not healthy. And then they use premium value, which means huge bag for almost no money. And so these are the four different strategies people use, or companies use. And the ones that I see troubles with sometimes, the premium attraction, the premium flavoring, because dogs like salt and fat. That's what their palate likes that.
Sure, they love them.
But things like Little Caesars and some of those things that are just really cute little packages that people say, hey, he ate that really good. Let's buy that again because he really likes it. Mm-hmm. It's a horrible way to choose dog food. But that's how people do it, because they think, well, he really good because it's got a lot of salt and fat and it tastes really. I mean, it's like French fries. You eat them real good, but they ain't good for you.
Good every now and then, but not on a consistent diet. And there really is something that you can starve an animal to death by giving it the wrong food.
Yeah, especially things that have too much of certain things, you can actually cause some problems. And there are, when your biggest issue is the fewest dollars per biggest pound of bag, those ones I watch a little bit, because they have to use something called least cost formulation, and they continually monitor commodities cost and buy whatever's cheapest, because now it'll have the same amount of protein and fat, but it comes from different things every week. And so sometimes see some things get into things that aren't as great, but it's the cheapest this week, and they have to do that in order to make a 50-pound bag for $12. They have to do that. You don't have an option.
So if somebody has a question about the right nutrition for their animal, they can just get in touch with you guys. Come on down, bring their animal down, and you can take a look at it and kind of figure by weight, age, different things, what the right type of meal might might be the right type of portion. That's also very important too, isn't it?
It is, and I actually we had a guy come by yesterday that wanted to just talk about nutrition for his dog. Just had puppies, and so we talked about that with him for quite a while. And so that was something that's just different part of life than most dogs deal with. So it's special diet, and different things are different for that part. So those kind of things, yeah, we can certainly get that for life stage. And also, you can take 10 dogs that are 5 years old, but those 10 dogs are all different. They're not the same. And I tell everybody, look at the label recommendations on the bag, but that is only a starting point because that company doesn't know your dog. They don't know if you got a spastic hyper lab or if you got a couch potato basset hound who just lays around all day. So they don't. That's a starting point only. Is all it is. It's not the end point. And I actually don't worry too much about amounts to feed. I just start with a set amount and then watch the dog and see for the next month how's he doing. Is he gaining weight, getting fat, or is he losing weight? And I'll just monitor how the dog's doing, and that's the gold standard, how the dog is doing, not what's on the bag label itself.
And when your pet gets overweight, how much pressure does that put on their internal organs, just like a human being? I mean, they can get diabetes. They can come up with the same types of problems that humans can't they?
Yep. I guess to summarize that best, Purina did the longest study that's been done in dogs, and they kept two groups of dogs. Each one in one group had a litter mate in the other group. One group they let eat whatever they wanted. Of course, there's labs, they got fat. And the other ones they kept a little on the thin side. And they did two things. They compared lifespan and cost of care. They have their own clinic, so they can do everything in-house. They did the whole, make a long story short, they could have quit the study at 12 and a half years of age when the last fat dog died, but they had to wait 2.5 years for the skinny dogs to die. And so 14 and 3/4 years was what the skinny dogs averaged when they lived, and their cost of care in the skinny dogs was 27% of what the real fat dogs cost. Even though the dogs live shorter, they cost way more to take care of. More arthritis, more skin conditions, more allergies, more heart problems. It was a lot of things. So, yes, overweight does cause a lot of troubles.
I wanted to ask you because I know we did this with our pet, and we took him in to actually get a physical. And people said, you don't give a physical to a dog. And I said, well, the dog has joint problems and hip problems, and it can have back problems. It can have things that you definitely want to get tested. You want the blood tested. You want things tested on your animal to make sure it's healthy. Don't you find that to be a good idea to have a physical done on your pet?
We recommend it once a year, and you'd be surprised how many times I'll say, by the way, is this lump here changed? And they say, what lump? I said, lump right here by his tail, and so they say, oh, I didn't know it was even there. Or this tooth looks a little rough, and they say, I never look at his teeth. So we find things all the time, or a heart murmur they don't know about. There's a lot of things that people wouldn't normally notice, or they think, oh, I thought all dogs had that. And sometimes we find a lot of things. And so most things are easier to deal with when I find them early than when I find them late. And so sometimes the further they go along, it gets harder and harder. We had a dog the other day that came in that had been limping for several weeks, and when I x-rayed him, he actually had a broken bone. I guess the car hit him, but I can't fix it now. 3 weeks later, it's too late for me to fix it.
It's tried to fix itself.
Yeah, it's started remodeling and starting to change, and at this point, I can't fix it.
You would have to re-break it again and then hope to try and set it correctly, and that's still an iffy proposition.
And when you get to that situation, it goes to an orthopedic surgeon for that. Yeah. Now, normal fixes, I'll do normal repairs on a lot of bones, but when it gets to having to re-break, remodel, and reshape a bone, that goes to the orthopedic guy. He does that.
So people need to pay attention to what their animal's telling them, not by what they can't say, but how they act and react to different things. And if you see a dog that normally would jump up on the chair, if you allow them to, jump up on a chair and jump down, they're no longer doing that, there may be a reason, right?
There's almost always a reason. Yep, almost always.
You definitely want to find out and don't put that beside. Let me ask you real quickly. I know you've been renovating your office, and we've talked about that a little bit before we came on the air. It's been a while. I know it's a long, slow process. How's it coming along? Where are you standing right now?
Yeah, we're, I think, probably 3/4 done. Steve Strickland's doing our work for us, doing a good job, and just takes a long time. There's a lot of stuff to do. We got roof on, paint on. We've got a lot of the new equipment and machines are in now and running. Got our gas anesthesia machines are in. Our laser machine is in. We got real nice digital x-rays are running now. We got our isolation room is in now in case we have a contagious animal come in. We've got some of our rooms built in. I'm going to have 2 or 3 exam rooms, and they're going to be a little different and better designed than before. We got a lobby being redone right now. Our reception area is going to be built, so later on we'll have an awning out over the front of the building, so if it's raining, you can get out and stay dry to come in without getting wet.
That's nice.
Yep, and we'll have a drive-through also on the side of the building. Sure. That's been put off a couple months, but it will be later on added on. Dental suite's coming later. It's not quite done. Surgery room's been redone. The prep room's been redone. Kennels have been reworked quite a amount. Lighting all's been redone. Lighting's done. Paint and stuff's on. So we're getting close, and I apologize to all the clients that come in when they're getting all the work done. The hammers are hitting, and and drills running and all that stuff. But it's nearing finished. We're going to try to finish it before the end of October. I hope we'll have it done. But it's coming along. So just making progress.
Well, you know, people need to understand it. It's a work in progress. You're still working.
Yep.
You
Every
know,
day.
and at the same time, you have to work kind of around that construction schedule, and they have to work around you as well.
Yeah, we're running a pretty full schedule, but just working around what's being done at the clinic there. Yep.
So if anybody has any questions about their pet, if they didn't call in today, but if they have questions or would like to make an appointment, how can they do so, Doctor?
Yep, we're same location we've always been, down at the vet clinic right down there, kind of by library and police station, pretty close by there. And the phone number is 6100 is the last part. 729. Yeah, 729-6100. So I'm still learning the phone number.
You don't call yourself, do you?
No, I never call myself. You know, and if you do, you press speed dial. You know?
Yeah.
So, but 729-6100 is the number, and same. It's never changed. It's the same as it always was. So.
And your hours are?
Hours we're running 8 to 5 Monday through Friday, and then Wednesday there's not a doctor in place, but we have people there to take care of things. If they want to come buy food or pay a bill or whatever, somebody's there to take care of answers and stuff.
All right, very good. So we wish you the very best for the next month, and happy Labor Day to you and yours, and have a good one. We appreciate Dr. Ouzts coming in and talking about pets. Remember, if you have an issue with your dog, your cat, or your pet, you definitely want to make sure you give them a call and get it in. The sooner, the better. Don't put it off. If your pet's starting to act differently, no matter what, there's probably some kind of issue. Could be nutrition, could be a bite, could be just might be arthritis. You know, just don't know. But do get it checked out. That pets your family. They really are. They become part of you. If you're going to go to the doctor, take your pet to the doctor.
Yes,